Hello, everyone, and welcome back to another episode of the Wellness Foreplay Podcast. We are Dr. Dondi and Marcy Nettles. We are your hosts, and every episode we bring 4 questions about a certain health topic that you should know about. And we give you the opportunity to share it when it hits home extra hard or when you know that it relates to people. But welcome to the Wellness Foreplay Podcast.
And it's actually episode 21. We're super excited to be bringing it to you. And it's a very, very important episode. So before we even get into it, please just go ahead and start sharing this with those people you care about, because it truly is going to be one of those things that I think is going to be gone. It's going to be written in history that in 2020, one of the most silent killers is what we're taught. It started with what we're going to be talking about today. Okay. And it's because our lives changed last year, didn't they? Quite a bit. But, you know, I am actually a former police detective, and you?
I am a former family wellness chiropractor.
And so we decided to bring our expertises together and do investigations into the knowledge that we know is the foreplay to your optimal wellness. So we're going to be bringing you a bunch of different nuggets, a lot of different information in these episodes. We just want you to pick 1 or 2 things, 1 or 2, not everything, because we don't want you to be overwhelmed, and an overwhelmed person does nothing. So pick 1 or 2 things that can help you on your wellness journey. Okay. So episode 21, it's all about DVT. DVT. What in the heck is DVT? Well, as Dondi mentioned, our episodes have 1 topic, and we answer 4 specific questions around that topic. And so should we go over what the questions are for today?
Yeah, before we get into what we are going to talk about, let us tell you what we're not going to talk about. We're not going to give you information that is intended to prevent, treat, cure, or mitigate any diseases. It's not what we're here for. We're here to educate you so you can be your best healthcare advocate for yourself and your family, and be more educated as you take on the authority role of your own health.
Yes. Yes. So empowerment is what this is all about. Empowerment. All right. So the 4 questions that we're going to be answering today around DVT is, number 1, what is DVT? It's like DVT, huh? I don't know. And then question number 2 is, who is at risk of developing DVT? Question number 3, how would I know if I have DVT? What are the symptoms? And then question number 4 is, what can I do to prevent or treat DVT? Okay. So I think the very first question is going to be like very right? Because you're all going to know that you've been experiencing this over the over 2020. But can you answer for us question number 1? What is DVT?
DVT is a condition where blood clot forms usually in your leg, somewhere in your lower legs. One usually, not both at the same time. Can be elsewhere, but it's usually in the leg, and it comes from prolonged sitting or a blood clot in a vein, a deep vein of your leg. And what DVT stands for is deep vein thrombosis. Thrombosis is the medical term for blood clot. So it's a blood clot in your deep vein of your leg, primarily caused from many different causes, but one of the most common for most people is prolonged sitting.
Oh, does that sound familiar? Did anything change in your life last year that you ended up sitting a lot more than you did previously to 2020? So just moving straight into, I know we did. So first of all, I know we did. We didn't get out and exercise as much. We didn't take as many walks as we normally had been taking. And yet we found ourselves on a lot more of these types of encounters, right? Yeah. Whether it was through live Facebooks or whether it's through Zooms, we found ourselves sitting a lot more. And, you know, our chairs weren't always the most comfortable either. And that can actually contribute to DVT as well. And we'll be talking about that a little bit more. So now are we ready for question number 2?
Yes.
Okay. So who is at risk of developing DVT? All of us.
Literally everyone.
All of us.
The most susceptible or at risk age is above 40. Because they tend to be less active. And that really is the key, is being sedentary, especially in a sitting position.
You know what, though? I would actually say that 2020 changed that too.
Oh, absolutely.
Because I know personally our kids, were definitely not as active in 2020 as they were prior to that.
With homeschool and everything else.
Homeschool, they ended up being behind Zoom again, and also not getting out or being able to get with their friends to where they were more active and doing those physical type activities. And so they were sitting more, playing more games, and just doing more sedentary things. So I would say that actually
Definitely.
That group grew last year for sure. So people that take long trips.
Yeah, especially air travel, car travel. Anytime you're sitting for a prolonged period of time, you're dramatically increasing your risk of DVT. And the reason is because, well, first of all, think about how the blood flows through your body. You guys have felt your heart rate before. You've had the doctor listen to it. And if you have a stethoscope around the house like I do, and you listen to your own heart, and our kids play around with it, you can hear your own heart. But your heart isn't the only way that blood flows through your body, because if you've ever felt your pulse, what you're feeling is an artery. An artery actually pulses just like your heart, which pumps the blood through your blood vessels. But what veins don't have is the ability to contract. When you feel a pulse, you're not feeling a vein, you're feeling an artery. But a cool thing about veins is they have one-way valves. So think about it this way. Arteries carry blood from your heart to your body to be used. Veins carry blood from your body back to the heart or back to the lungs to be filled with oxygen again, then into the heart, and then back out through your body again via the arteries. But veins have one-way valves. So once the blood passes through that valve, it doesn't go back the other way. That's really the inherent problem when you sit. When you sit, especially if you sit in a hard chair or a chair that has a sharp lip and it pushes on the back of your thighs, it can actually cause compression in your veins and stop the blood from flowing freely through the veins. And when it starts to get stagnant, or it doesn't move nearly as rapidly as when you're moving around and you're exercising, you're active, it starts to get blood clots. There's things called clotting factors. They're kind of sticky little proteins inside your blood that start to coagulate. They start to stick together. And when they stick together and you sit idly for a prolonged period of time, it starts to develop a blood clot. And that is what a DVT, or deep vein thrombosis, is.
Yeah, and it doesn't really take a long period of time sitting for this to happen. You know, it's like we flew home from California yesterday, and it was only like an hour and 30-minute flight.
Yeah.
And yet I felt the pressure on the backs of my legs. I felt the stiffness down through my knees and through my calves and even up into my hips, which could be an indicator of a reduced flow of blood.
Yeah. And one of the things about DVT is 50% of the time you have it, you don't even know it. There's no symptoms. You're not feeling any symptoms. But the other 50% of the time, there are very, very identifiable symptoms, which we'll talk about.
Yeah.
But just because you're not feeling anything doesn't mean it's not, if you're not being affected by it. And there's also ways to avoid it, which are just common sense ways we'll share with you.
Yeah, most definitely. So we covered sitting for long periods of time, whether that is just because you're behind the screen and working or just watching something, sitting in cars for distance rides, and also airplane travel, right? So long periods of time sitting. What about smokers?
Smokers and people on birth control are much likely to have more of those sticky proteins, clotting factor, in their blood, and they're more likely to develop clots than people who don't smoke or that are not on birth control pills.
Yeah, and then we've also got the situation with bed rest.
Bed rest, yes.
Yeah.
Again, because you're immobile, you're not, especially in a horizontal position, because gravity is what feeds the blood to your body with the assistance of your heart rate, obviously, and your heart beating. But what goes up against, and that's why you have one-way valves, because when the blood goes up through the one-way valve, it doesn't go down. And the more your heart races, or the more your heart pumps rather, and this is the other thing, it's not just your heart. Your muscles, when they contract, when you move your muscles, just in walking, the contraction and relaxation of your muscles every time you take a step helps pump that vein-based blood back into your lungs, which will go through your heart and out to the body again. So movement is very key. And when you're on bed rest, or you're lying down or sitting down for prolonged periods of time, the blood starts to get thick.
Yeah, guys. So as we're going through here, please know that this information is vitally important for you because it can be life-saving, learning what you're learning right now, but it's also vitally important for anybody that you know. So currently right now we're live on 3 different platforms on Facebook. And so if you guys are thinking about anybody, even, you know, people that are close to you, or even just people you've just met, please share this out, share this broadcast so that they can see this information, because I truly believe that this DVT is going to be the silent killer that stemmed from 2020. Okay. And so we've got to make sure that people are aware of what it is and what they can do about it. So please share it if you're on here with us live. And if you replay, please do it as well if you're on Facebook. And if you are one of our podcast listeners, thank you guys so much for listening in. And if you could please just share this podcast, share it out so that others can be aware and know what they can do or what they should be looking for, right? What they should be looking for. Because as we go further into this, you're going to see it can be really serious.
It definitely it is literally life-threatening. It can be fatal if you don't take care of it. And you don't, if you're having the signs and you're not doing anything about it, or what I used to call the 5 most dangerous words in health, maybe it will go away. Don't ever say those things to yourself. If you are having some of the symptoms, and we'll talk about that, this could be a life-threatening, very, very serious situation. So don't play your odds. There's things you can do to prevent from getting you that way. But if you're feeling some of these things and it starts to get serious, and we'll talk about what could happen. What is the risk of DVT when it goes into the lung, when the blood clot breaks free, goes through your circulatory system into your lung and becomes what is called a pulmonary embolism. That can be life-threatening. You do not want to play around with that. So we're not yet there. We'll get further in there in the episode, but we want to talk more about some of the risk factors that go along with promoting and helping you increase your risk of getting DVT.
Yeah. So what was your 5 words? What?
Maybe it will go away. The 5 most dangerous words in health.
And then you could also counter it with this one. What if it does not?
True.
Right? What if it does not?
You don't want to play
because you do not. No, you don't. You don't want to take those chances. So let's move into question number 3.
Well, we still got some other. So the other risk factors. Obesity. If you're overweight, or people that are sedentary, you're not moving around, people that are dehydrated, you want to make sure you exercise. You want to make sure you lose weight if you're obese. You want to make sure you stay hydrated, because blood that is properly hydrated is a lot less likely to get clotting factors or actually start to thicken up and clot. So staying hydrated, 50 to 75 ounces of water per day for every 100 pounds of body weight should be your goal, to stay hydrated. And we talked about before, how do you know if you're dehydrated? The one at number 2, when you go to the bathroom, number 2, if it looks like little pellets, you're dehydrated. You need to increase your water from 50 to 75 ounces of water every 24 hours for every 100 pounds of body weight.
Awesome.
So yes, increasing your exercise, losing weight, stop smoking, get off birth control pills or use other types of birth control. Stay hydrated, exercise, eat right, eat good nutritious foods that aren't causing cholesterol, because high cholesterol can be a risk factor for DVT. So the more health and wellness principles you apply, the better off you're going to be and the less likely you are to come down with DVT.
Well, I've already identified a couple things that I need to do more of, and that is moving my body. So getting out and walking more. It doesn't have to be strenuous exercise, guys. It's just a matter of getting your blood pumping, right? So you could use a rebounder, and we'll talk more about that.
We'll do a whole episode on rebounders.
Yeah, we're going to
surgery is another thing.
Oh,
if you've had a recent surgery, the risk of blood clots, because your body is healing a wound, and it's very, very common to have blood clots in an area that your body is healing, because that's part of the way you stop from bleeding to death. Your blood clots, or what is called coagulates. It's a normal part of healing. But if you've had a recent surgery or a recent trauma, those are some possible risk factors also for DVT. So just be aware of the symptoms, which we're going to talk about next. So if you start having some of these things, be curious, start focusing on it, start looking at what you could do to minimize them and be healthier.
All right, so let your ears perk up now, because we're going to go into question number 3, which is, how would I know if I have DVT? What are the symptoms? So how would you know?
So the most common, and again, remember, 50% of the time that DVT is existing in someone, there are no symptoms, but a very strong, the most popular one, not popular, it's not popular at all. The most common one is if you have a swelling or pain in your leg for no apparent reason. It just showed up. It's a big, big sign. Or pain and swelling in the calf. It just showed up. It's a very good sign of DVT. Another thing is redness of the skin, warmth to the touch. If your leg, usually it affects one leg or the other. Not typically, it's very unusual for both, but it can happen. But if either of your legs are swollen, they're red, or even bluish, they're warm to the touch, and they're painful, especially when you move and stand up, very, very good sign of DVT.
Yeah. Okay. So I need to get some changing in my daily activities, because when I stand up to walk, I've got some stiffness in some of my joints, my lower extremities. When I go for self-care and get my massages, I've got some pretty sensitive, tender spots in my calves. So that, those are some things that you can actually just be more aware of too, when you're maybe getting out of the shower and putting body lotion on, feeling your calves and seeing if there's any really tender spots.
Yes.
Those kinds of things can be ways for you to just kind of start identifying the potential of this situation. Okay.
Now, maybe some of you are thinking, but I have to sit. My job requires that I sit, or my schooling requires that I sit. Have no fear. The answer is here. So think of it this way: 5 minutes of exercise for every 30 minutes that you're sitting down, and you can actually do it in place. So calf raises. So lean forward on your chair, put your tiptoes on the ground and do calf raises. Do 10 calf raises, and then point your toes. Point your toes. So point your toes toward the floor. So calf raises, point your toes toward the floor, and then point your toes toward the ceiling. So if you don't know what a calf raise is, point your toes, lift your heel up off the floor. You're contracting your calf muscles. That's a calf raise. Then do the opposite. Put your heel to the floor and point your toes to the ceiling. Now you're stretching your calves. If you can keep your calves exercise, it will help with the flow back up into your thigh muscles and then back up into the blood supply. So the other thing you can do is knee raises. Move your ankles around in a circular pattern. Just sit there and do 5 minutes for every 30 minutes that you're sitting down. And it's best, obviously, if you can get up and move around.
Yeah.
Get up and walk around for 5 minutes. It's even better. But doing it in the standing position is even better. But there's like situations where there's turbulence. I have to stop
you. You're really jumping into question number 4.
Okay.
You're totally going to question.
I'm going.
And there's something else that's really, really important. He's got a note here in our notes that is vitally important. It's like life-saving importance here. You've actually got information here on if a blood clot breaks free and moves through your bloodstream, it can get stuck in a blood vessel of your lungs and be life-threatening. Okay, guys, it's like
called a pulmonary embolism.
Yes.
Or PE for short.
And is there warning symbols or symptoms to this, or warnings?
There is chest pain, instant onset of difficulty breathing, coughing up blood, pain in your chest, pain in your lung areas are all cardinal signs of when the deep vein thrombosis breaks loose from your leg, goes into your circulation and then goes into your lungs and gets lodged in your lung and becomes now a pulmonary embolism. This is life-threatening. You do not want to play around with it. So if you have an onset of, you just can't breathe and there's no reason, you're coughing up blood is a very bad sign. Call 911 immediately, go see your doctor immediately. This is not where you say, maybe it will go away. Because if you do, maybe you will go away. And you do not want to play around with this.
And guys, I want you to know, this is serious to the fact that if you're in great health, you can still have this problem if you are sitting too much.
One international flight for somebody who's in incredible shape, athletic, say they run a triathlon, one international flight can cause DVT. You don't want to play, which is why you wanted the precautionary measures, exercise 5 minutes for every 30 minutes you sit down.
Yeah, so that's why we wanted to do the episode today on that, and make sure that you're sharing this out to everybody, because everybody seriously needs to know, because this could be life-saving. Because heart attacks, think about that. Most people don't know that they have a heart problem until they have a heart attack. And
50% of the time.
And 50% of, think about the fatality rate of, it's called a widowmaker, right? And so that's why I keep saying that I think that this is going to be that next silent killer that came out of 2020. And so you need to be educated on DVT, what the signs of it are, how you can see whether or not you might be leading towards that, what the risk signs are, of needing to go and get emergency care. But we really here on the show are all about being proactive and preventative. And so we want to move into question number 4 now, that will help you with that.
On the risk factor. So if you're when you cough or you take a deep breath, it's painful in your lungs, it's another sign. Increased heart rate is another sign. So, and these are the things you don't want to play around with these. The ones that are coughing up blood is an immediate 911.
Right, absolutely.
But if you've got pain when you breathe in deeply, pain when you cough, difficulty breathing, increased heart rate, these are things you should definitely call your doctor right away. But another way to prevent them too, if you have a tendency, and if you've been treated for this before, and maybe doctors prescribe blood thinners, which is the medical approach. I'm not saying anything negative about that. For some people, they need that. But there's also compression socks. If you have a tendency, or you travel a lot, you travel long distances a lot, and you're sitting a lot, compression socks would be a great idea for you.
Yeah, absolutely. And that's also getting into question number 4. So question number 4 is, what can I do to prevent or treat DVT?
Yeah.
Okay, so obviously we've already talked about that 5 minutes for every 30 minutes that you're sedentary, getting up and moving your body, whether you do jumping jacks, whether you go for a brisk walk around your backyard, or even up and down the stairs in your house, whether you jump up and down on a rebounder, which is really, really great. It actually is it's a compound effect. It's like for every 5 minutes, you're getting like 15 or 20 minutes of regular exercise when you do the rebounder.
Great for your lymphatic system flow too.
Yes. And then you can just walk around too. Get up and just do leg raises.
Move around.
Bend
Move your
knees,
butt, baby.
high knee, whatever you need to do. You just got to get moving, right? And then the compression socks is another good one, especially for air travel.
Air travel, yeah.
It's really great for air travel or after those incidents of trauma. Many times doctors will put compression socks on patients that are going through surgical procedures. I know that all the surgeries that I've had myself personally, I always came home with compression socks. So those are some of the things there.
And they're sexy too.
Sure they are. Yeah.
Said no one ever.
Oh my gosh. Are you serious? So you want to make sure that you're avoiding the risk factors. If you're overweight, lose weight. Okay. That's on my docket to get busy on, right? So lose some weight. Leg exercises, again, 5 minutes for every 30 minutes of prolonged sitting. So get up and just walk around. How about compression socks again? Stop smoking, eat alkaline foods.
Yeah.
You talk about that a little bit.
Because acidic foods, you're going to be more likely to have high cholesterol if you're eating acidic foods. So eat more alkaline foods and stay hydrated, and you're going to have a much less likelihood of having cholesterol. And cholesterol is a risk factor for DVT because of those sticky proteins that are in your cells, which actually are in your blood, that actually cause the coagulation or the clotting of your blood. Yeah.
Yeah. And, massage is another good thing. Schedule some good care. Okay.
Good self-care.
Self-care is important, and massage is one of those, and it helps with your circulation. It helps with anything that is getting bound up before it becomes a problem, but you need to have it on a regular cycle, not just when you feel like you absolutely need it. You need to have it regular. It's so good.
Massages are good on date nights too.
Hey, tonight's date night.
It is.
Hey, all right, we don't need to go into that. Stop that right now. And then let's see here. Choose other methods of birth control.
Yes.
So, I think we've given you a good idea of the things that you can do. I would say the most important is just get up and get moving.
Yeah, move around, move around, move around.
Yeah.
Did I say it again? Move around.
Move around and hydrate. So those are the 2 things that I'm going to really focus on. Think about 2 things that you're going to be focusing on for this coming week. We personally would love to challenge you, just that 5 minutes for every 30 minutes that you're sedentary, to get up, get moving so that you can prevent. We're all about prevention here, right?
All about prevention. An ounce of prevention is worth a pound of cure.
Yeah. So let's be preventing that DVT. And yeah, I got to tell you, those compression socks definitely are not in my lingerie case. You're a nut. But guys, so that was episode 21. All about DVT. And I hope that you can understand a little bit more about why it's so important that you have this knowledge, but also why it's so important for you to share this out. So please do us a favor, share this out with at least one person that you know that needs to hear about moving their bodies more, taking better care, and what to be looking for that could be a risk you know, a
Mhm.
high risk symptom
Yeah.
that they need to be getting medical care for, because we don't want any of you to not be here for as long as you are
That's
intended
right.
to be, because you're all amazing. You are all absolutely perfect.
And you got things to do.
Yes. And we have
A
time
legacy
to
to
watch you
create.
do them. We want to see you doing all the
That's
greatness
right.
that you were created for. All right, guys, we love you so much. Thank you so much for joining us for episode number 21 of Wellness Foreplay.
Yes.
Dr. Dondi and Marcy Nettles, thanks for joining us, and we look forward to seeing you on episode 22. And just to kind of give you guys a little bit of an idea, I think, and we haven't really talked about it, but I think it's time.
All right, let's do it.
I want to ask you a question. What do you know about BII?
Oh.
Okay. What do you know about BII? We're going to be talking about BII on episode 22. So just in 2 days from now. It is a really interesting conversation that we're going to be having. It's something that I've just recently started learning about in the
Me
past
too.
60 days.
Mhm.
And it is actually a journey that I'm personally on. So I'm going to be sharing some of my experience, some of my new awareness, and hopefully it will be eye-opening to many of you, that
It's a big deal.
it's a really big deal, and many women are being affected. So BII actually stands for breast implant illness. So that's what episode number 22 is going to be about. So I hope that you will all join us, get all of your friends on here, especially if you know any women that have breast implants. They need to hear this information. Okay. All right, guys, we love you. Thank you so much for joining us today for episode 21, and we'll see you on the flip side for episode 22 of
That's right.
Wellness Foreplay.
Thanks, everybody. God bless you.